I'm Sien Ombelet. I'm a doctor from Belgium. I graduated in 2010 and I started working for Doctors Without Borders in 2014. Because of the outbreak of Ebola, they sent me to Guinea in West Africa. So an Ebola mission is in general a very intense kind of mission because you work very long hours in very difficult circumstances. So Gekedu, where I was working, is the place where it actually all started in March 2014. But of course, as soon as you went into a bit more remote villages in the forest area around Gekedu, people are very distrustful. So there's been lots of conspiracy theories in all three countries where people thought it was actually medical staff infecting patients, that it was actually medical NGOs from the West who were infecting the patients and who had spread Ebola in their region. What is also very badly needed in the region is lots of health education towards the population, because as I said, they were quite distrustful at first. So you need people to go into the villages, preferably people from that region who can explain what Ebola is, how you can try to avoid getting it. Because of the Ebola outbreak, the whole of the public life in those countries has lain still for like a year because the hospitals were understaffed. The staff didn't want to go to work anymore because they were afraid they were going to catch Ebola. People also didn't want to go to hospital anymore, not even for illnesses like malaria or HIV or for delivering a baby, because they were afraid that by going to the hospital that was actually going to infect them with Ebola. At the moment, the only diagnostics that we really have for Ebola is PCR. This is polymerase chain reaction diagnostic techniques. So that works very well, it's very accurate, but it's very difficult. You need a real lab, actually, you need very trained personnel. So those are all things that are lacking in these remote places in Africa. It would have been much better if we would have a more simple technique to diagnose Ebola that could be employed in every healthcare center all over West Africa. Until now, we've not really found something that is highly effective. There were already some companies doing some modest work towards a vaccine, but because in the previous outbreaks the number of patients were always very small. So you are dealing with the population in remote Africa with very small numbers. Of course, for no pharmaceutical company, it could be profitable to make a vaccine. It wasn't always easy, but for me, myself, I always felt quite protected with the gear that we were wearing. I have a lot of confidence in the organization of Doctors Without Borders as well. I knew that they had a lot of experience. Ebola is an indiscriminate disease, so lots of people get infected. So you see pregnant women who are all going to lose their babies because Ebola is very lethal for the fetus. You see lots of children coming in, and also children have a worse prognosis, have a worse outcome than adults. So when children come in, you know that they are very likely to die, and they have to come in without their caregivers. They are small children, 4 years old, 3 years old, and their mother is not infected, but they are. So the child has to go in and the mother has to stay outside of the center. Sometimes there was not a lot you could do. You could put in an IV line, give them fluids, but sometimes the thing that they mainly needed was just someone to sit there and hold their hand, give them something to drink, give them some medication that would make the pain go away at least. And it's those things that we focused on mainly, trying to get people as comfortable as possible, trying to make sure that if they were going to die, if there was nothing we could do anymore for them, medically speaking, that at least we could give them some kind of human decency, that they did not have to die all on their own without people they love, covered in their own filth, in their own secretions. To avoid all those things, I think that was for me one of the most intense experiences, to try to really be there for the patients, even if you can't do it medically, that at least you can provide some other kind of support.